Good evening. Thank you for joining us for Medicare 101. This is a 4-part series, and this is going to be Medicare Part 1, Eligibility and Coverage. Appreciate you joining us tonight. Hopefully everybody got the email that I sent out earlier today that included the handouts and a copy of the slides so that you can follow along with the presentation. If you did not get that email, please leave a note in the chat so I can make sure that you do get it, if at the very least after the fact. This is also being recorded, so if you aren't able to stay through the whole thing, we will be posting it to our website in a day or so. Just a couple of housekeeping notes. I will pause throughout the presentation to see if anybody has any questions. If you do have any questions, you are welcome to type them in the chat and I will address them at the pause. Or when I do pause, you're welcome to simply unmute and ask your question, and I'm happy to answer that at that time. And I think that's it for housekeeping. So we'll go ahead and get started. So good evening. My name is Roma. I'm with the Area Agency on Aging and the Pikes Peak Area Council of Governments. And this is our 4-part, 4-week series, Medicare 101, that I will be doing every other month for the next several months. And I appreciate you guys coming. Let's get started. So again, I'm with the Area Agency on Aging. The mission of the Area Agency on Aging is to work with our partner governments and partner communities in the El Paso, Park, and Teller County area to develop systems and programs that allow people to stay in their homes and in their communities for as long as possible. Within the Area Agency on Aging, I am the coordinator for the SHIP program, or the State Health Insurance Assistance Program. This is a federally funded program. Every county and every state has access to a SHIP counselor. And what we do, we are basically consumer advocates for Medicare, all things Medicare, or all things that could possibly be related to Medicare. Under the SHIP program, I actually cover 9 counties in Colorado. You can reach our office in any of those 9 counties by calling the local Colorado Springs number shown on the slide, or you can contact a SHIP office anywhere in the state by calling the statewide 888 number, and it will route you to the SHIP office closest to the county you're calling from. Again, every county has access to a SHIP counselor, at the very least by a statewide toll-free number within their area. So tonight we're going to talk about Medicare A and B. Next week we will talk about insurances to go with Medicare A and B, and the week after that we'll talk about Medicare Part D for drugs. And then we will talk about, on the last presentation, every other kind of insurance that could coordinate with Medicare. But tonight we're going to talk about Medicare A and B, and we're going to talk about cost, coverage, eligibility, enrollment, all those kinds of things. So we're going to start with who runs Medicare. So basically, it is Social Security that determines who is eligible to get Medicare. And they do that by tracking employment history. So it's Social Security that determines your eligibility. It is Social Security you have to contact to actually enroll in Medicare. They are the ones who provide you with your Medicare card. And you can contact them through a toll-free customer service number. Once you're enrolled in Medicare, Social Security wants nothing to do with it. And if you have any questions specific to Medicare benefits, coverage, claims, etc., you would actually contact CMS, or the Centers for Medicare and Medicaid Services, basically Medicare, and I'm going to refer to them as Medicare. It is actually Medicare who determines what benefits are covered. They administer the program, they process all the claims, they pay the providers directly. You can contact Medicare by toll-free customer service number, which is available 24 hours a day, 7 days a week, 365 days a year. Numbers listed on the slide. There is no brick and mortar location for Medicare. You can only reach them through the toll-free number, or if you go to the Medicare.gov website, you can chat with them online. going backwards. So just a couple of brief notes. We are located in Colorado Springs, and we are lucky here in Colorado Springs that we do have a regional Social Security office. There are several throughout the state. This slide lists the local Colorado Springs office and their address, as well as the nationwide toll-free number for Social Security, which is available to call 7 a.m. to 7 p.m. in all time zones, or you can go to the socialsecurity.gov website. Just a couple of quick notes regarding some recent changes. And these changes are continuing to evolve as the weeks go by. But effective January 6th of this year, Social Security offices no longer accept walk-in clients. You have to call and schedule an appointment before you go to the local Social Security office if you need to go there. And then this may have changed, but a couple of days ago, it was as of April 1st. If you were unable to go online to enroll in Medicare or to start income benefits through Social Security, you would have to go to the local office and provide your proof of citizenship, such as a birth certificate or a passport. And you would have to call and schedule an appointment to do that. Again, these are some new changes that have come from the federal government. These changes do seem to be evolving on a case by or a day by day basis. So again, I'm not 100% sure that April 1 effective date is still accurate. It may have been changed to April 14th, but I still think that this is going to apply to people who are wanting to collect Social Security income. It should not apply to people wanting to enroll in Medicare, but again, we're just going to have to keep an eye on the news to see what changes may come down the pike in the near future. You can enroll in Social Security or in Medicare through the Social Security website, ssa.gov. You can also create a personal account on that website, which is the easiest way to go. Has a lot of benefits. Social Security does not require that you have a personalized account. You can enroll in Medicare without creating an account, but there are some benefits to it that I will talk about as we go through. So, who can have Medicare? Well, basically any U.S. citizen that turns age 65 or older and has paid into the tax system, primarily through employer taxes, either through their own employment or potentially through a spouse's employment, will automatically become eligible for Medicare at age 65. You can become eligible for Medicare at any age if you are disabled and you apply to Social Security for disability. You're approved by Social Security for disability and you receive at least 24 disability income payments. After those 24 payments, you automatically become eligible for Medicare. You can also receive Medicare at any age if you have been diagnosed with kidney failure and you are receiving kidney dialysis, so end-stage renal disease, or if you are diagnosed with Lou Gehrig's disease, ALS, and you can apply for Medicare immediately. And then any lawfully admitted resident alien who's resided in this country for at least 5 consecutive years is eligible to purchase Medicare. When can you enroll? So basically, there are some enrollment periods that you do need to be aware of. Also, you don't need to be retired. And there are a lot of people who work past age 65 these days. Excuse me. So a lot of people may not want to enroll in Medicare at age 65, but that is the earliest age you are eligible. And there is an enrollment period that surrounds that 65th birthday. It's called your initial enrollment period. And that initial enrollment period lasts for a total of 7 months. And those 7 months include 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and up to 3 months after the month of your 65th birthday. That is your window of opportunity based on your initial eligibility to enroll in Medicare. If you enroll in any of the 3 months prior to the month of your birthday, your benefit goes into effect the month of your birthday. And it really doesn't matter what day of the month your birthday is. Your benefits would start that first day of that birthday month, unless your birthday is the first day of the month, and then your benefits start the month before that. If you enroll in Medicare anytime during the month of your birthday or 3 months after your birthday, your benefit would start the first day of the following month. And there are other enrollment periods that we're going to talk about. If you don't enroll during any of the enrollment periods that we discuss here tonight, you would still be allowed to enroll, but possible delayed enrollment without good cause or good excuse could incur future penalties when you do enroll. And we are going to talk about that. So other enrollment periods that you might be eligible for. Medicare has special enrollment periods or which are special opportunities to enroll in Medicare benefits or coverages that go with Medicare based on specific situations. So for enrolling in Medicare A and B purposes, honestly, the only excuse Social Security will accept for not enrolling in Medicare when you are eligible at age 65 is if you are still actively employed and are covered under employer group coverage, or you're the spouse of someone actively employed and are covered under their employer group coverage. That is, again, the only excuse Social Security will accept for not enrolling in Medicare when you initially become eligible at age 65. If you do continue to be employed or have employer coverage through you or your spouse from active employment past age 65 and you choose not to enroll in Medicare because of that, when you do decide to stop working or your spouse decides to stop working and you lose that employer coverage from active employment, you actually get an extended amount of time to enroll in Medicare at the end of that employment without penalty. You get an 8-month window instead of a 7-month window from the time that employment ends. Or you can enroll in Medicare anytime while you're still actively employed or covered under active employer coverage. And we will talk about that a little bit more as we go on. The last enrollment period for enrolling in A and B purposes is the general election period. So if you didn't enroll during your initial enrollment period surrounding your 65th birthday, you didn't enroll based on a special enrollment period because you were actively employed, Medicare still will allow you to enroll in benefits any year down the road during a specific 3-month period, January 1st through March 31st every year. That's called the general enrollment period. If you enroll in Medicare during the general enrollment period because you missed or didn't have the special enrollment opportunity, if you're enrolling during general enrollment period, you will be penalized because you didn't enroll during initial enrollment, you didn't enroll based on a special enrollment because you were still working, you're enrolling now. There are penalties imposed when you enroll during a general election period. So it is very important to pay attention to these enrollment periods and understand the rules in which you can enroll in Medicare. Oh, oh, sorry. So this is what the Medicare card looks like. I call it the red, white, and blue card. It will simply have your name. It will have a random series of letters and numbers as your Medicare ID number, and it will indicate when your Medicare Part A and Medicare Part B go into effect. That's it. You used to have to sign them. They used to have other information on them. This is all that they have on them these days. A couple of things to take note of. If you're going to go ahead and enroll in Medicare, make sure your contact information and your mailing address is up to date at Social Security, because it is Social Security that is sending you that card. It is Social Security that is enrolling you in Medicare. You want to make sure that they have the accurate information to mail you the card, because you don't want your Medicare card to be mailed to somebody else. Also, just a quick note of caution, because this scam is going around again now. If anybody tries to call you and ask you if you've received your Medicare card just to confirm that everything is okay and you've gotten what you need, that is a scam. Social Security will never call you and ask you if you've gotten your Medicare card. They'll never call you unless you're expecting them to call you. They don't just have the time or the energy or the staff to just make phone calls and make sure everything's okay with you. If anybody does call you and ask you about that, it is a scam. Um, if you want to get their phone number and give me a call and give me their phone number so I can report it to the state, that'd be great. Otherwise, just hang up on them. And that scam is going around right now. In the email that I sent out earlier this morning, it did include several handouts. This is one of them. I sent out 2 handouts from Social Security that this one shows the types of services that can be provided through the online website, socialsecurity.gov or ssa.gov. And the other one was kind of a walkthrough on how to enroll in Medicare through the Social Security website. The other handout I provided was this handout that walks you through once you have a Medicare ID number, you can go to the medicare.gov website and create your own personalized account on that website. Neither Medicare nor Social Security require that you create a personalized account. There are some benefits to doing that, but they don't require it, and you can do anything you need to do on either of those websites without the account. But keep in mind that the government is going to lean more heavily on online services as time goes on. So there are a lot of advantages to creating those accounts now. So I will take a quick pause and see if anybody has any questions. Again, you can simply unmute and ask a question, or you can type a question into the chat. All right, I'm not seeing any questions. I'm not hearing any questions, so we will move on. All right. So now that you have Medicare, or now that you're eligible for Medicare, there are a couple of things you want to take into consideration before you enroll in Medicare. Again, employment is going to be a big factor. Also, if you are already collecting a Social Security income, say you started collecting early at 62 or 63, or you're a railroad retirement beneficiary, collecting income from the railroad retirement benefit. If you're collecting an income when you turn 65 and become eligible for Medicare, Social Security will automatically enroll you in Medicare. They'll not only automatically enroll you, but they will also start deducting the payment for Medicare out of that income. Again, if you are actively employed or your spouse is actively employed and you guys are covered under that employer group coverage, you can delay enrollment into any part of Medicare without penalty. And then you can wait to enroll in Medicare and when that coverage ends or that employment ends. You can also enroll in Medicare any time during that employment past the enrollment period. But again, that is the only excuse Social Security will accept for not penalizing you for not enrolling when you turn 65. A lot of people who do continue to work will go ahead and enroll in Medicare Part A, but not Medicare Part B. And we'll talk about why in just a minute. But active employment is the only way to get out of being penalized for not enrolling when you first turn 65. For most people, again, there are 2 parts to Medicare, A and B. For most people, Medicare Part A is going to be no cost. And that is because you have worked and you've paid into the Social Security and Medicare tax system through employment, and you have earned enough working quarters or credits to earn Medicare Part A at no cost. Basically, you have to earn a total of 40 working quarters or credits, which is the equivalent of a total of 10 years of work history. Now, whether you earn those 10 years right out of high school, or you earn those 10 years before you turn 65, or you earn those 10 years working, part-time over 30-year period. It doesn't matter. As soon as you have 10 full years of work history paid into the tax system through employer taxes, you are automatically eligible to get Medicare Part A at no cost when you become eligible and enrolled in Medicare. If for some reason you don't have enough working quarters when you turn 65, and a lot of people might not, could have been a stay-at-home parent, um, whatever. When you become eligible for Medicare at 65, you can still purchase Medicare Part A, but it's not cheap. Medicare Part A for people with less than 40 work quarters could pay a premium as high as $518 this year, and that premium does go up every year. If you have 32 or more work quarters, you pay a little bit less. If you have 32 or less, you pay up to $518. If you're not sure how many work quarters you have, because you had a sporadic work history, whatever, you'd have to contact Social Security and ask them how many they have on record for you. Or you could go to the Social Security website and create a personalized account and find that information on your own. So, what does Medicare Part A cover for all of that? Basically, Medicare Part A is going to be your inpatient benefit. So whether it's an inpatient hospitalization, an inpatient psychiatric stay, an inpatient rehab stay, inpatient services are covered under Medicare Part A. The most common service is going to be inpatient hospitalization for whatever medical needs you might have. Medicare Part A will cover an unlimited number of inpatient hospital stays, but every time you're admitted to the hospital, Medicare Part A will cover all of that cost except for a deductible. So whether you have a $5,000 inpatient hospital stay or a $500,000 inpatient hospital stay, Medicare covers all of it except for a $1,676 per admission deductible. And when I say per admission, if you have 3 hospital stays in a 12-month year, that deductible could be applied each time. That deductible and that admission covers you up to 60 consecutive days in the hospital at a time. If for some unfortunate reason you are in the hospital for longer than 60 consecutive days, Medicare will continue to pay for your stay, but they will start applying what they call a coinsurance, meaning they'll continue to pay everything except for this year $419 per day. They'll pay everything else. And this is starting at day 61 consecutive days. If you're there longer than 90 consecutive days, that $419 jumps up to $838. And then you start going into what they call lifetime reserve days. And you get another 60 of lifetime reserve days. And those lifetime reserve days are only applied when you have extended consecutive day stays, 90 days or higher. Fortunately, most of the time, hospitals want us in and out of the hospital as quickly as possible, 3 to 5 days on average. So the likelihood of anybody getting past 60 days hopefully is pretty slim. But again, per admission, that's $1,676 deductible up to 60 consecutive days. A benefit period for inpatient stays is considered 90 days. And you would have to have at least 60 days from the time you're discharged from a hospital stay to the time you're readmitted to a hospital before they could apply that deductible for a second time. If you're rehospitalized within a 60-day period of being discharged, you may go back into the hospital starting where you left off when you were discharged the first time, and they would not apply a second deductible. That same thread is applied to psychiatric inpatient hospitalizations, but Medicare does put a maximum lifetime amount of days that they will cover in a psychiatric hospital where there is no limit for medical hospitalizations. So 190 days lifetime max for psychiatric inpatient stays, no maximum, no limit for medical stays. While you're in the hospital, Medicare will basically cover anything you need based on that hospitalization. But there are some things Medicare does not cover, such as you having a private room while you're in the hospital, unless it's deemed medically necessary and ordered by a doctor. Or, you could be in a situation where that's the only room they had left because they were really busy. You can't request having a private room and expect Medicare to pay for it, basically. Medicare also will not pay for any of the first 3 pints of replacement blood someone might need. And that's any part of Medicare. Medicare, period, does not cover any of the first 3 pints of replacement blood someone might need, does not cover private duty nurses or room sitters, and does not cover what they consider self-administered drugs. Self-administered drugs are most likely going to be something you'd have to worry about on the day of discharge from a hospitalization. So say you've been in the hospital for 3 or 4 days, it's you're going to be discharged, but it's taking them all day to get you discharged. And while you're waiting for discharge, it becomes time for you to take your maintenance medications, your Lipitor or whatever. And so they come in and they bring you a little cup full of pills and they hand that cup to you and you swallow those pills. Because it's the day of discharge, you're no longer inpatient and they can bill you privately for those pills you just swallowed. On the other hand, you could submit that to your Part D. We'll talk about that later. But those are the kinds of things you need to be aware of. Also, another thing I wanted to make mention of when it comes to inpatient hospitalizations, if you, for some reason, had to go to the emergency room and your emergency was such that they decided to send you upstairs and put you in a room so they could observe you to make sure that whatever you're there for doesn't get worse. Please be aware that there's a difference between being under observation in a hospital, even if you're there for multiple days, versus actually being admitted to a hospital for a medical need. Medicare pays for both, but it's different parts of Medicare that pays for observation versus admission. The hospitals are required to notify you within 24 hours whether you've been admitted or if you're still under observation. So just be aware of that. Not all hospital stays are going to be considered inpatient admission stays. And the hospitals are by law now required to advise you if you're still under observation or you're being admitted within 24 hours. The last benefit of Medicare Part A, or one of the last benefits, is skilled facility, basically inpatient rehab after a hospital stay. The way this benefit works is if you have been admitted to a hospital and you've been in that hospital for at least 3 nights, 3 days or longer, being admitted officially for a hospital stay, and then you're discharged. And the doctor comes to discharge you and says, I think you should go to rehab for a couple of weeks to get some therapy on your knee because you just had surgery or what have you. The doctor wants you to go to rehab for recovery and therapy. As long as you've had at least 3 days of inpatient hospitalization before you're discharged to a skilled facility for rehab or recovery, Medicare will pay for that skilled facility rehab or recovery. Medicare pays 100% for the first 20 days. Again, these are consecutive days. They'll pay 100% for the first 20 days of any skilled facility admission for rehab or recovery. If you're there longer than 20 days, again, Medicare will pay everything except for a coinsurance, meaning they'll pay everything except for this year $209.50 per day starting at day 21. Medicare will pay 100% for the first 20 days and everything except for the $209.50 for the next 80 days. Again, consecutive days. If you're still in skilled rehab after 100 days, starting at day 101, Medicare no longer cares why you're there because they will stop paying for that stay, period. If you have not gotten well enough to go home from rehab, even if you go home and continue to get therapy or what have you at home, if you have not gotten well enough to be able to go home after 100 days, Medicare has determined that you're probably not going to go home because you're not getting well enough to go home. So Medicare does not cover what they consider custodial or long-term care stays. And once you're determined to not be able to get better or well enough to go home, Medicare stops paying for care. So on day 101, you are going to be in a private pay situation. In that scenario, if you are still in that facility at day 101, you would have a couple of options to continue staying there. Again, you could just privately pay out of pocket, which could be kind of expensive. You may have purchased long-term care insurance back in the day that could help you cover some of that cost if you're going to be in that facility for the long haul. You may qualify for Medicaid to help pay for that continued stay. So there are options that you could look at, but Medicare is not one of them. Medicare will pay up to those 100 days at a time in a skilled facility rehab as often as you need them to do that. So you could have multiple rehab stays after a 3-day or more hospitalization, and Medicare will pay that formula every time. But they'll only pay up to the 100 days. So you get a 100 days or more, or 100 days benefit period as often as you need it. The last benefits through Medicare Part A are going to be if I can get the page turned, are going to be home health care and hospice. Home health care obviously would be what you would get if you were able to be discharged from rehab and go home and get continued physical therapy or care for your medical needs at home instead of in the facility. Hospice care is for end-of-life care. It's comfort care for people who are determined to be at their end of their life expectancy. Both benefits do require that a doctor certify eligibility every 60 to 90 days for both. There are no deductibles. There's 100% coverage for both services, both types of care, with the exception that if you need a piece of medical equipment like a wheelchair or a hospital bed, that's going to be billed under Part B of Medicare. There may be a coinsurance, and some limits apply, but very few. There is no limit to how long you can be on hospice or get home care under Medicare Part A, as long as you continue to meet the eligibility criteria. And the doctor continues to submit that to Medicare every 60 to 90 days. Again, very little out of pocket, if any, for both of those services. Take a quick pause to see if there's any questions about Medicare Part A. Again, you can type into the chat or unmute and just ask a question. Not seeing any, not hearing any. We'll move on to Medicare Part B. So Medicare Part A was your inpatient stuff. Medicare Part B is going to be your outpatient coverage, all in any outpatient services. Again, things to take into consideration, like I mentioned before, if you're already collecting a Social Security or railroad retirement benefit, when you enroll in Medicare, the premium for Medicare will automatically be deducted from that income. If you're already collecting it when you become eligible, you will automatically be enrolled in Medicare, whether you wanted to be or not, unless you tell them otherwise. And again, if you're actively employed or your spouse is actively employed and you guys are covered under the employer health coverage, you can delay enrollment in Medicare without penalty. Again, for most people, Medicare Part A is at no cost. Medicare Part B is where the premiums come in. Everybody has to pay for Medicare Part B. And in some cases, what you pay could depend on how much income you report to the IRS. There are some scenarios where you might not need Medicare Part B. There are some scenarios where you absolutely would need Part B. Scenarios where you need Part B, so you have to have A and B of Medicare, is if you want to buy insurance that's designed to coordinate with Medicare, such as a Medigap or a Medicare Advantage plan. Also, if you're retired military and you become eligible for Medicare, if you're not employed and you're enrolled currently in, say, TRICARE Standard or TRICARE Prime, when you become eligible for Medicare, you would be required to enroll in Medicare unless you're actively employed with employer coverage. If you didn't enroll in Medicare when you became eligible, you could potentially lose all TRICARE benefits. I also get a lot of veterans who ask if they need to enroll in Medicare, specifically because they tend to access the VA health system, and they use that as all of their care, their primary care, which is a legitimate question. However, what I explained to them is that the VA is great when you're accessing it, but the VA provides care and coverage for medical conditions that you may have developed while serving. And the VA does not have facilities available everywhere. If you use the VA system, that's great. If it's working for you, that's great. But if you enroll in Medicare, that gives you an additional um, ability to get care anywhere for any reason, because Medicare does not care what you need, why you need care, or what caused you to need care. If you need medical care, Medicare will pay for it. And you have a much wider variety of providers to access if you have Medicare in place in addition to the VA. Also, if you do not enroll in Medicare because you access the VA, and then you decide a couple years down the road that you want to go ahead and enroll in Medicare for some reason, VA is not considered employer coverage, so you would be looking at penalties to enroll in Medicare down the road. Again, and I keep harping on this because it's important, if you're still working, you can delay enrollment. You can enroll in Medicare anytime while you're still actively working once you become eligible. And once you stop working and lose that employer coverage, you get an extended enrollment period of 8 months to go ahead and enroll in Medicare without penalty. But if you don't enroll during those timeframes of your initial enrollment period surrounding your 65th birthday, or that delayed enrollment because you were actively employed, Medicare will let you enroll any year down the road during general enrollment, January 1st through March 31st, but you will be penalized. And the penalty is going to be applied to Medicare Part B premiums. The base premium for Medicare Part B in 2025, $185 a month. Again, if you're collecting Social Security or Railroad retirement benefits, that $185 will be automatically deducted from that income every month. If you're delaying enrolling in income through Social Security, but you're going to go ahead and enroll in Medicare, then you'll be billed directly that $185 a month. And they'll either bill you quarterly through the mail, or you can arrange to have electronic funds transfer taken out of a bank account every month. But $185 is the base premium. That's the lowest anybody pays, unless you have a significant annual income. And again, premiums can vary based on having a higher income, and we'll talk about that in the next slide. If you're enrolling in Medicare during general enrollment period, here's how they calculate the penalty. Late enrollment penalty for Medicare Part B is going to be 10% of the monthly premium of whatever that premium is the year you enroll. So say you became eligible 3 years ago, you weren't working, you simply just didn't enroll for whatever reason. Now, 3 years later, you want to enroll in Medicare during that January through March period. Medicare or Social Security is going to say, this year the premium's $185. You waited 3 years. We're going to penalize you 10% of the $185 for every year you delayed. So it's going to be a 30% penalty. They're going to multiply that times $185. Whatever that comes out to is going to be tacked on top of $185 every month forever. So once you incur a penalty, that penalty is monthly and it's forever. It doesn't increase, but it never goes away. And then if you're paying a higher premium, it could be because you're means tested based on higher income. Other out-of-pocket costs for Part B are going to be an annual Part B deductible, not a per admission, but this is a once a year annual deductible, $257 this year. Drop in the bucket compared to most deductibles. Once that deductible is met for your outpatient services, Medicare pays for all of those Part B outpatient services at an 80-20 split. Simple as that. Means tested premiums for Part B, again, based on income and based on what Social Security can access for official income records, which is going to be through the IRS and your tax filings. And they're going to access the most current, most complete IRS tax filing, which is probably going to be from last year or the year before, because it has to be a complete closed filing for the year. So for 2025, Social Security could likely be looking at what your income was in 2023 based on your tax filings. The thresholds where you might have to worry about paying a higher premium start for a single person at $106,000 a year for 2025, at $212,000 for a married couple. They also have numbers for married filing separately. You can go to that website that was referenced on the previous slide for more information. There are different levels of income, and at the higher the level of income you go, the more you have to pay. So if you're at the highest level of income, which is for an individual, $500,000 or more per year, based on what you made in 2023, you could pay an additional $406 on top of the $185 for Medicare Part B. Social Security will look at your income tax filings every year. So if you were still working, you had a really good job, you were making really good money in 2023, and that's what they look at, and then they send you a letter saying you have to pay higher premiums for Part B in 2025, but you have since retired and your income is no longer $106,000 or more. When they look at that record again the next year and they see that your income has been reduced below the limit, so will your premium reduce. So it's not a situation where once you're determined to have to pay a higher premium, it's going to be forever. It changes as your income changes. If for some reason you get hit with that higher monthly premium based on income that Social Security is looking at, but you have had a sudden loss of income, say you got divorced or something like that, you can apply or appeal to Social Security to ask them not to make you pay that higher income when you enroll. And there's a form and a whole process that you can go through. So even if you are determined to have to pay a higher premium, if you have a situation where you can't afford to do that, they're not going to make you, but you do have to appeal that. So don't panic. There are ways around it. What does Medicare Part B cover? Again, it's going to be all your outpatient stuff, office visits of any and all kinds, lab and x-ray services, medical, surgical, anesthesia services. Medicare also will pay for a second opinion for medical needs. Medicare Part B will pay for replacement blood starting at pint number 4, covers your emergency ambulance rides, covers your annual vaccines to include the flu shot, the pneumonia shot, the shingles vaccine, all of your outpatient physical, occupational, and speech therapies with some limits, covers all your durable medical equipment needs such as oxygen, wheelchairs, walkers, those kinds of things. And it does have some limited coverages for other services such as podiatry, optometry, chiropractic. Those are covered services, but with much more limitation. They will only cover those services in very specific scenarios where Medicare, for the most part, will cover any medical need you have without limit. The key to getting Medicare to pay for anything, whether it's under A or B, is need. You have to have medical necessity, and the doctor has to say to Medicare this was a medical necessity to get this service in order for Medicare to pay for it. But as with Part A, there are some things Medicare Part B does not cover, regardless of necessity. And that's because they've basically determined these things aren't necessary. So Medicare Part B does not cover routine physicals. So if you're used to going to the doctor once a year and then putting you on the treadmill and all that kind of stuff, Medicare doesn't pay for that. Nor do they pay for routine foot care, hearing aids or the fitting of them, routine eye care such as eye exams to see if your prescription has changed or the glasses associated with it. And even in a medical eye service that Medicare will pay for, if you get a refraction of your eyes during that medically covered service, Medicare will not pay for the refraction. Medicare still does not pay for dental, nor will they cover cosmetic surgery, again, not medically necessary. Now, there are exceptions, and what I've learned after 25 years is there's always an exception to everything when it comes to Medicare. So Medicare does not cover routine physicals. Their answer to that is a welcome to Medicare preventive visit. And then if you miss your welcome to Medicare preventive visit because you get 12 months from the time Medicare kicks in to use it or lose it, Medicare will still give you an annual wellness review. The key thing to those two services is that they are not physicals. What those two services are basically in-depth conversations with your doctor so that your doctor can get your health history, your social history, your family history, help you determine if there are any preventive tests that might be something that you want to take advantage of. So say you have a family history of cancer. He may recommend that you go get a specific kind of cancer screening as a preventive service. That's Medicare's answer to a routine physical. When it comes to things like podiatry, foot care, Medicare will not cover foot care if you just can't clip your own toenails. But if you have a medical reason you shouldn't clip your own toenails, such as pulmonary vascular disease or diabetes, Medicare will pay for the podiatrist. Same with eyeglasses. They won't pay for the exam to see if your prescription has changed or the glasses associated with that. But if you're going to the eye doctor because you are developing cataracts or glaucoma, poke yourself in the eye with a pencil. Those are all medically necessary services Medicare will pay for. There are no exceptions for dental still. I thought there was a glimmer of hope a few years ago, but that is back on the back burner. Hearing aids or hearing services in general, not covered by Medicare, still considered not medically necessary to have teeth or to be able to hear. Again, thought there was a glimmer of hope there a few years ago, but at this point, that's not even on the table. But Medicare does and has decided to cover preventive care in the hopes that preventing illnesses to develop to the point where they are life-threatening, that will be more cost-effective, obviously. Medicare covers a lot of preventive services, and they pay for all of those services at 100%. I've listed like three, very minimal list of three. But if you're interested in all of those services to see what may or may not be available to you, I recommend you go to Medicare.gov and download the Medicare and You Handbook for 2025. In that handbook, there's like a 25 or 30-page section that details all of the preventive services Medicare will pay for, and it explains the criteria for getting that service, how often you can get it, etc. All of those services that Medicare cover as a preventive service have a little blue apple next to their description, like you see on the slide. That means it's a preventive service because more than just preventive are described in that section. But very, very detailed section with lots of good explanations on Medicare's coverage of preventive care. But again, medical necessity for Medicare to cover anything is the key. If for any reason a doctor is suggesting you go get a service, but you're not quite sure why, and they're not real clear on explaining why they think you should go get that service, I encourage you to ask. Ask questions. And I know sometimes that's hard, but you've got to advocate for yourself, because if you go get that service the doctor is suggesting, but that doctor is not telling you that you need that service, Medicare is probably not going to cover that service, because the doctor is not going to turn around and tell Medicare it was medically necessary. So that is key to any Medicare coverage and benefit. Okay, so that is part B in a nutshell. Any questions about anything we've covered so far?
I have a question just for clarification then.
Yeah.
If they don't cover your annual physical, but they will cover your annual wellness review,
Mm-hmm.
if you schedule an annual wellness review and they want to do like typical blood work or something just to see what you look like, is that
So
covered?
if you're going for an annual visit to the doctor and they have to do blood work, there's usually a reason why they're doing blood work. Because maybe you are on a prescription that they just need to check the blood work, make sure everything's okay with that prescription, something like that, right? In that kind of visit, that is not a preventive visit. That is not your wellness review. That becomes a medically necessary visit because there's a medical reason you're there, right?
Okay.
Preventive, the because that doctor feels the need to get blood work, it changes the category of visit, and it becomes a medically necessary, just medical visit. You go for a wellness review when you have no other reason to go. And
Okay.
if you are wanting to take advantage of the Welcome to Medicare preventive visit when you first get Medicare, make sure that when you schedule that appointment, you are very clear that you want this to be your Welcome to Medicare preventive visit, so that they bill it properly and they provide all the services that they're required to provide.
Okay.
Same
All
with
right.
the
Well,
annual review. What's that?
yeah, I guess I still, I mean, normally to me, my experience with annual physicals is there's just a bunch of questions, and normally it includes a blood draw just to see where you are. Just there's no reason, they just do it.
Yeah.
But
Well,
uh,
Medicare's not even going to do that much. It's going to be a conversation.
yeah, okay.
Yeah.
So in general, unless there's a good reason, they're probably not going to cover what I've been experiencing pre-Medicare.
Correct. Yeah, unfortunately, that is correct. Yep.
Understood. Thank you.
You're welcome. And it looks like we have a question in the chat. If still working, does your employer need to sign any form documenting that you have insurance? That's a good question. So if you delay enrollment into Medicare because you are still actively employed, have employer group health coverage, no, you do not need to inform anybody that you are not going to enroll in Medicare. However, when you do stop working and you lose that employer health coverage, there is a form that your employer is going to need to fill out that says, yes, this person was working from this state to this state. They had health insurance through us from this state to this state. That's your proof that that's why you did not enroll when you first became eligible. And the employer can submit that to Social Security on your behalf. If for some reason that employer no longer exists, and I've had this happen, they've gone out of business, whatever, you can submit that and just self-attest to that. And for the most part, they'll take your word for it. But yeah, it's a specific form that you can go to the Social Security website to download and take to them. I would hope HR departments for most employers would be aware of such forms and perhaps have them available, but I don't take that for granted or make any assumptions. Um, I can tell you what the form is. If you're interested, just give me a call or shoot me an email. After this presentation, I'm happy to provide that information to you. But yeah, you don't have to do anything prior when you become eligible. It's when you stop working, lose that employer coverage, and are ready to enroll in Medicare, you have to provide some sort of proof that that's why you didn't enroll initially. So hopefully that answers your question. Any other questions? You're welcome. All right, we're almost done. We're running out of time. So the last thing we're going to talk about is a couple of programs called Medicare savings programs. These are financial assistance programs to help people cover the cost of Medicare. So Medicare savings programs, these are federally funded programs. So it's assistance directly from the federal government because this is a federal benefit that can help pay the Medicare Part B premium so that they do not deduct it out of your Social Security. Depending on your income and assets, you could also get help covering your Medicare A and B deductibles or co-insurances. If you apply for or are automatically qualify for Medicare Savings Program, it also automatically qualifies you for assistance with Part D drug costs. So it reduces your prescription costs. But you have to apply for this program through the Medicaid system, basically. So it basically is a Medicaid application, even though it's not technically a Medicaid program. However, if you're already on a Medicaid program, such as long-term care Medicaid, or you have SSI, supplemental security income, or are on Medicaid for some other reason, it will also automatically make you eligible for Medicare savings and make sure that those costs are covered so that you're not paying them out of your income. But this program does have income and asset limits that you have to be within in order to qualify. So for 2025, this slide shows you the income and asset limits for different levels of this Medicare Savings Program assistance. These are gross dollar amounts per month, so pre-deduction monthly income amounts for individuals or for married couples, and the asset limits. The asset limits can be increased if you already have a prepaid burial arrangement of some sort, or cremation arrangement, or anything like that. You can add another $1,500 to those asset limits. The asset limits are going to look at financial accounts. They're going to look at property that you own but don't live on. They're going to look at um, rental properties, those kinds of things. They do not look at the home that you live in, the property that sits on, or your primary vehicle. They do not look at your personal possessions. So if you have a $50,000 diamond ring on your hand, they can't count that as an asset. But they are going to look at financial accounts of any and all kinds and properties that you don't reside on. These limits do change, meaning they increase a little bit every year, but usually they increase just as much as the cost of living. So it's hard to get ahead of that. If anybody's interested in more information about these programs or is interested in getting an application for these programs, we do help with these applications here at our office. All of us are trained to assist with that, and we are happy to do that. Just give us a call or shoot us an email. And then again, if you have any questions after this presentation, because that's all I have for you today, again, you're welcome to reach out, give us a call. If you're not in the El Paso County, 3-county or 9-county service area, if you call that 888 number, it is going to route you to the SHIP program closest to where you're calling from. There are about 13 different SHIP programs throughout the state. If you are simply interested in more information about the SHIP program, State Health Insurance Assistance Program, you can go to the website shiptacenter.org or shiphelp.org, and it will give you information about the history of this program and what we do, and information about how to become a volunteer for this program. We're always looking for volunteers. Also, I'm hopefully going to be sending you a survey sometime tomorrow for to get your feedback on these presentations. It will be electronic. If you don't get it for some reason, please let me know. Feedback is very important for our funding, especially these days. We also have a sister program, the Senior Medicare Patrol or SMP program. This program focuses on educating and empowering people to protect themselves and detect and report potential Medicare fraud, abuse, and errors. It is also always looking for volunteers. So anybody interested in getting more information about this program, you can go to the SMP resource website, smp.org, or you can give me a call or shoot me an email, and I'm happy to give you more information. And like I mentioned, we are always looking for volunteers. If you are interested in learning a skill that is very specialized and very important and very popular once people know that you know what you know, give me a call. We do all of the training in-house. The certification process is done online. We're very flexible. We're always happy to talk to people who are interested in volunteer opportunities. So just let me know. And that's it. That's all I've got for you. Any last questions before I let you all go and get on with your evening? All right. I don't see any questions. I don't hear any questions. So again, thank you all for joining me tonight. Hopefully you will join me again next week when we talk about the insurance options that are available for coordinating with Medicare, such as Medicare supplements, also known as Medigap, or Medicare Advantage plans, which is what you're probably getting junk mail out the wazoo for. We will talk about both of those things in depth next week, same time, same place. Other than that, if you have any questions in the meantime, feel free to shoot me an email at seniorinsure@ppacg.org. You can give us a call at our local or toll-free statewide number, and we're happy to talk to you. And other than that, thank you, and I hope to see you next week.